Coming up on MedWatch Today, a home away from home, the place that offers comfort to friends and family while a loved one receives critical care. And breaking it all down, a look at hospital ratings, what they mean, and how you can use them to find the right care for you.
It's a blessing that they did catch it.
Plus, catching a vision problem at day one, the risks for premature babies, and how local doctors are making a difference. Hi there, and thanks for joining us. I'm Julie Musgrave. You may not know there's a place for families to stay who live far from Fresno but have a loved one in critical care at Community Regional. For an idea of how far we're talking about, take a look at this. Community Regional provides the highest level of care for 15,000 square miles. That's the same size as Connecticut, Rhode Island, and New Jersey combined. So you can see why Terry's house is so valuable, having a place near the hospital that makes Fresno feel like home. Gloria Morak is from Connecticut and didn't exactly have plans to spend time in Fresno.
My niece was here working for the summer, and she went hiking with her friends and she fell off a 50-foot waterfall.
Her niece brought to Community Regional Medical Center for treatment, the only level 1 trauma center in the valley. Gloria followed shortly after with her sister. They had no plans and no place to stay.
When we checked into the hospital, they were asking us, where are you staying? And we said we didn't have any plans, well, whatever. And they said, well, do you want to be on a waiting list for the Terry's house? And I said, oh, that would be wonderful. What is the Terry's house?
The Terry's house provides a home away from home for families that have a loved one in a critical care unit at Community Regional Medical Center.
Krista Short is the director.
So it goes above and beyond the hotel-like experience.
Opening back in 2011, right across the street from Community Regional, Terry's house offers a warm bed and several layers of support for families that live 30 miles or more outside of Fresno.
They have all of the comforts of home, including a huge community kitchen. We have a children's playroom. We have a community resource center, a laundry room. We have an outdoor healing garden and an indoor reflection room.
There's even a pet-friendly space and the promise of a hot meal at the end of a long day. But to make all this happen, it truly takes a village. Terry's house is 100% funded on donations alone.
I think when people see the impact of their gift here, it's not just helping families right here in our own backyard, but we become the porch light to Fresno for the entire world.
Krista says it's a place to go when life isn't exactly going as planned.
They are all in the midst of absolute chaos and typically very devastating times, but to be able to support each other and know that everybody here is going through something similar, it gives them that bond that really lasts a lifetime.
You just become a family when you're here.
And walking through those doors immediately felt like relief.
It just looked like a home.
Gloria's stay spanned several weeks as her niece healed more and more every day.
And now it's a happy day. We're going home.
Back east, but Gloria says she'll always remember her time out west at Terry's house, an unexpected home away from home.
I'm very grateful that there's something here for everyone that needs it.
It's $30 a night to stay at Terry's house, but if you can't afford it, the Leon S. Peters Host Family Program is there to provide financial assistance. They do not turn families away if there is room available. If you'd like to donate, either financially or volunteering your time, there's a link with more information on MedWatchToday.com. When you're seeking hospital treatment, obviously you want the best, so you may turn to hospital ratings, but you'll quickly find there are a ton, and they're not exactly easy to understand. Dr. Thomas Utecht joins us now to explain what these ratings are and what they really mean to both the hospital and you. Dr. Utecht, thank you so much for joining us today. Now, we hear a lot about hospital ratings. What exactly are those?
So typically a hospital rating is done by some agency, whether it's a government, typically we talk about CMS, or a state agency or a private agency that takes hospital data and compares it to other data, other hospitals typically, and then comes out with some kind of rating. They're difficult to interpret because all those variables can be done differently. So how the patients are submitted, how they're compared, the hospitals they're compared against, and then the grading systems used are all different as well. Some are stars, some are points, some are letter grades. So it is truly a conundrum for consumers to understand that.
Is there an easy way to decipher what you're reading?
Yeah, the short answer is no. There are better grading systems, I believe. The CMS grading system is probably one of the most validated, but even that speaks mostly to Medicare patients and also can be difficult to understand at times, and the way that they risk adjust, which is an industry term for how sick a patient is complicated for even physicians and people that do this for a living. So the answer is no. I would say that probably the best thing to do is to make sure that if you're looking at a hospital is to make sure that they're fully accredited. Typically that would be by the Joint Commission. And then discuss with your physician about what you're seeking hospitalization for, treatment, etc. I think your physician is probably the best guide to understand what those quality measures are, how your hospital compares within them.
And how do you as a hospital use these ratings to then make it a better patient experience?
That's a great point. We certainly do pay attention to all of these ratings. We try and prioritize them based on how we think they pan out and their importance. And then we are constantly working to try and improve them. Looking at hospital-acquired infections, for instance, working on that diligently to try and decrease those and bring them to zero. That's a goal that we will have probably until they are zero.
All right, Dr. Utecht, thank you so much. We sure appreciate your time.
It's a pleasure.
Coming up on MedWatch Today, scientists uncover a way to weed out genetic disorders directly from DNA, the controversial technique that could change generations to come. And this week's healthcare hero admired for her work ethic and the tiny lives that motivate her toward a job well done.
Hi, my name is Dr. Vasi Gardikas, and I'm a breast surgeon. And my health tip for you for the day is to know your family history. Breast cancer can come from your mother's side or your father's side, and so it's important also to know your paternal history. Know that only 10% of breast cancers are linked to your genes, but it's also important to know about the other types of cancers in your family.